Thank you for attending our talk. We would like to rectify that the people who participated in this work is from Mexico, from the Autonomous University, National University of Mexico. So not from South Africa. So we're just going to rectify. We're another very different continent, but you will see we're kind of related. I'm going to present in behalf of Dr. Roberto Campos Navarro. I will be the interpreter. So at the end of the presentation, you can ask me the questions and I will translate for him. So this work deals with a long-term therapy log kept for 20 years by Rosita Ascencio, a native Mexican healer, traditional healer. So I will give you a small introduction because Mexico, in the area of Mexico, it was the cradle of a civilization like it was in other areas in the world. So in Mexico and Central America, we know this region as Mesoamerica, where the oldest civilization known as Olmecs established. Centuries after the Olmecs, other cultures developed in the area. Cultures you know as the Toltecs, Mayans, and Mexicas, also known as Aztecs, but Mexicas is the proper name for them. In the 16th century, Spain invaded this area, colonized the area and brought with them a lot of elements of different cultures, European cultures, but also from Africa through the slave trade. This caused that a lot of traditions from other continents were introduced in Mexico and they coexist together. Native Mexican knowledge about medicine was already vast. So as an effort to condense all this information, this book was first written and drawn by Martin de la Cruz in 1552. Martin de la Cruz was an indigenous medic, and he was the first one publishing this, edit this book. And 20 years later, a Catholic priest called Bernardino de Sahagún edited the Florentine Codex that we can see here, which compiled medical knowledge from elder Mexican Mexicas. In this codex, we can find some of the first references to medicinal plants like tobacco. Tobacco was used by Mesoamerican people as ritualistic, but also because other healing properties like as anti-inflammatory. Obviously, not used smoked. It has to be used in a different way. And I said it was used also in rituals because it was used as an hallucinogenic. Gradually, over time, more plants were introduced to Mexico from other parts of the world, and now they are used widely all over the country. This is the case for chamomile, wormwood, aloe, and rosemary. And all the influence from other continents and all over centuries has caused that many techniques and traditions of medicine, including different plants from other countries around the world, are used in Mexico right now. Now I'm going to talk about Rosita Ascencio, who was a native Purepecha. And Purépecha people are native from the central area of Mexico. They have their own culture, their own language, but Rosita Ascencio, later in life, she learned nursery voluntarily at a Catholic boarding school and learned to speak Spanish. Rosita was born in Pátzcuaro, Michoacán, in the state of Michoacán, in central Mexico. You can see Mexico City, and a little bit to the west is Michoacán, in a town that is just at the side of a lake. And in this area, lots of antique traditions still persist, like the Day of the Dead, like also traditional dances like the elder dance, and a special technique of fishing with butterfly nets. So it's a unique culture, not similar, that can be differentiated from other cultures in Mexico too. So these are pictures from Rosita when she was young. And when she grew up, she formed a very big family where she started to practice her medicine knowledge. But then she extended these treatments to the people in the town. Those treatments were so effective that she became the official traditional healer of this town. She was so good that she was not even recognized in her town, but she was also recognized by the government. So she got an official recognition as an herbalist and traditional healer by the Health Bureau of Mexico, and she was in charge of the regional herbarium and a medicinal plant orchard. Rosita Ascencio was so influential that she was the representative of all the traditional healers of the Purépecha area. And she shared her knowledge in different places, in different cities in Mexico and other countries in the world, such as the case of Costa Rica and Winnipeg in Canada. In Winnipeg, Canada, she actually participated helping to develop new policies for the to regulate the how the traditional medicine was going to work in certain areas of Central America, and this was for the World Organization of Health. Something that Rosita did that not many traditional healers actually do is to record every patient she treated over 20 years. So since 1992 until, sorry, I said 30 years, sorry, until 2022, she recorded every patient she had and recorded the name, the age, the date of treatment, the sickness or diagnosis, the treatment, and where these people came from. So when Dr. Roberto Campos used this data, we found a lot of interesting information. For example, we can see here that the number of patients over time actually was on average of 100 patients a year. But you can see that there are a few drops in the number of patients. In 1998, there was a drop because she had a car accident, so she wasn't able to work as well. But later, after 2014, she became sick and she was becoming deaf and unable to see anymore. So that's why she wasn't able to treat many patients at the end, in the latest years. Something interesting about the patients of Rosita is that most of the patients were kids under the age of 4, but she also treated other patients, like elderly people. She had patients, both male and female, and they were about the same amount over the years, almost the same amount. But they were and mostly from their own town. So we can see in this figure that the color green represents the people from her town, Pátzcuaro, and the other colors represent people from other areas of Michoacán in yellow, of the state, or other states in Mexico in purple. And she also had patients from other countries shown in blue. She diagnosed several illnesses that are known as culturally affiliated syndromes, pretty much like the previous talk in Chinese medicine, is syndromes that include several characteristics that don't necessarily fit the Western medicine labels. So these are the main illnesses that she treated. The first one is susto, which is something like fright, and it's associated with a phenomenon in which the person apparently loses its soul due to a shocking experience. The second one is empacho, which is similar to an indigestion and is probably related to some element that gets stuck in the gastrointestinal system and causes diarrhea, fever, vomit, and it's very, very common in kids. We have mal de ojo, which is equivalent to the evil eye caused by the envy of other people, and nervios, which is similar to distress, which is also associated with maybe anxiety, but it's not exactly the same. So just let's keep that very, very clear. It's not the same thing saying nervios and anxiety. It's just, this is just approximations to Western medicine labels. So most of her patients were brought to her as kids to be treated for susto or fright. After that, most of secondly, they were treated for empacho, then mal de ojo or evil eye, then distress or nervios, and then for intestinal infections. The most common treatments she gave were massages, then secondly, herbal drinks, thirdly, massages mixed with tinctures, and finally, ritual cleansing. Ritual cleansing is called limpia in Spanish, and it consists on several acts, like in this example on the upper right picture, in which she is bringing back the soul of this kid through blowing air into the body of the kid. It can also be done by cleansing or brushing plants all over the body of the patient. And there are also ways to prevent the evil eye by using amulets, like in other cultures. So in Mexico, it's very common to use something called ojo de venado or deer's eye, which is a seed of a tree that has to be wrapped around the wrist of the kids with a red thread. And that prevents evil eye in Mexican kids. So almost every parent in Mexico does that the kids. And the other picture shows how she uses tinctures and massages with patients of all ages. And massages are a very important method to treat empacho. So she can do massages in the area of the abdomen, but also she practices something, the pinching of the back, the skin of the back of the patient. So it causes a popping sound, and it's like something gets unstuck, and then the patient is cured. Now these are the plants that she mostly used in her treatments. Very interestingly, the most used plants are not even native Mexican, are rosemary and chamomile, but there are others that are actually Mexican. Secondly, thirdly, and fourthly, she used estafiate, which is like a Mexican boomworm, worm. Then arnica mexicana, Mexican arnica, eucalyptus, and then lastly, she used Castile rose, rue, borage, and green tomatoes. And most of these plants can be grown and found in the gardens of the houses in the town that Rosita used to live. Okay, not working anymore. Okay. So this is a personal story of Dr. Roberto Campos during a trip, a work trip for a conference. Dr. Roberto Campos was robbed and he was shot in the leg. And after he was hospitalized and had the bullet extracted, he went to visit Rosita to be cured for susto, for fright. And such was the impact of Dr. Campos by the quality of the human quality of Rosita and her energy and her knowledge that this relationship ended actually in a book that was published in 2016. And this book talks about the life of Rosita Ascencio. It took 10 years and was published by the most important university in Mexico, UNAM. And it was very well accepted by specialized and general public. You can see here the presentation of the book is full of people. There was also people, famous people, actors and singers of Mexico that my dad didn't know they were there. And Rosita was very popular, very loved, and that also shows how a hairworm person can be a healer, not just a doctor. Sadly, in 2002, Rosita got very sick and passed away. And but the legacy of Rosita will persist because of her diligence keeping the records of all the patients, and all that information is being recovered by Dr. Roberto Campos and his team, and will persist for further generations, and it will be shared with the world eventually. Thank you very much. If you have any questions.